Calcium supplements are dangerous. And if you take a calcium supplement, you need to watch this video. Now, when I say they're dangerous, that's not just my opinion. The information that I'm going to give you in this video has been published in all the medical journals. As far as I know, the first time this information made it into the medical journals was about 2010, and I saw it in the Journal of the American Medical Association. And it was research conducted at Johns Hopkins. That's a prestigious medical school, as you know. And one of the statements that they made in their report was that the best calcium supplement is none. These people were recommending no calcium supplementation. The director of the research made the following statement. I'm very concerned about the potential for calcium supplements to contribute to heart attacks and heart disease. The body can't process more than 500 milligrams of calcium at a time. If you take a supplement with more than that, your body has to do something with the excess. It's possible that higher calcium levels in the blood could trigger blood clots, or that calcium could be deposited along artery walls, which would contribute to the narrowing of blood vessels. So the body can't process more than 500 milligrams of calcium at a time, and yet the standard recommendation for postmenopausal women is 1,200 milligrams a day. And I've known people who are taking much more than that. In fact, I recently had a discussion with a man who has had spinal surgery, and his orthopedist recommended 2,400 milligrams of calcium a day in the mistaken belief that taking calcium is going to help his bones to heal faster. And by the way, calcium supplements will do nothing for osteopenia or osteoporosis. They won't prevent it, and they won't correct it. Researchers in Australia reported that in women taking calcium supplements, they observed a 70% increase in kidney stones, a 100% increase in hospital admissions for gastrointestinal side effects of the calcium, and a 20 to 40% increase in heart attacks. Now remember, 50% of heart attacks are fatal. Other studies, including one published in the Journal of the American Heart Association, showed an association between calcium supplements and increased risk of cardiovascular disease, including heart attacks. Another study showed that calcium supplements may cause intestinal polyps, which can turn cancerous. So, colon cancer, that's a nice thing. You don't want that. This research is old. It's been around for a long time. And yet, nothing has changed. Doctors still tell women to take calcium in the mistaken belief that the calcium supplements are going to do something for their bones. Now, calcium is an important mineral. We do need calcium. The problem is that in the modern diet, most people are getting more than enough calcium, in many cases excess calcium, and drinking commercial milk, eating commercial dairy products is a fallacy, because that's going to cause more problems, like the researchers in Australia observed, and commercial dairy products are harmful to the body anyway. Nobody should be consuming commercial dairy products. The one exception I make there is butter. Butter is healthy. It's better if it's butter from raw milk. It's better if it's grass-fed, better if it's organic, but do the best you can. But butter is healthy. Butter substitutes are not. Here's another study, a very famous study, the Nurses' Health Study, conducted by researchers at Harvard and Cornell universities. And this study showed that the women who had the highest consumption of calcium from dairy products had substantially more fractures than women who consumed less dairy. So here you've got a situation where health professionals are telling people, especially postmenopausal women, to take calcium supplements for their bone health, and it's harming their bodies. It can cause, according to all this research, heart attacks, strokes, gastrointestinal problems, all kinds of health problems, including more bone fractures. It's doing nothing for bone health. In fact, it's detrimental to bone health. Meanwhile, these health professionals are not recommending the things that truly do beneficially impact bone health. I've written extensively on this subject. There are articles about this, about the calcium issue on my newsletter, longlifehealthy.life. I've also written articles about the things that you can really do and supplements that you can take that do have a beneficial effect on bone health that can help to not only prevent osteopenia and osteoporosis, but they can help to restore bone mineralization. And it's not calcium. So check out my newsletter, longlifehealthy.life. There are countless articles on there on just about every health subject imaginable. And it's not just stuff that I've taken from the internet. Most people who write blogs and newsletters just do an internet search and they're only repeating all the same boilerplate stuff that they find on other websites. I research very deeply and I provide information that you're going to have a hard time finding anywhere else. So that's longlifehealthy.life. Also, I've written a book on health, Dr. Curtis's Guide to Staying Healthy with Science-Based Non-Pharmacological Medicine. The reason I write my newsletter and the reason I wrote this book is because I can't give you all the information in these videos. And there's so much information that I want you to have. So you can get it on my newsletter. You can find the book on Amazon under Dr. C. M. Curtis or link in bio.